Hello everyone, my name is Ginny and I'm joined with Aisha, Hannah, and Matthew to answer the question, should I have a blood pressure machine? In this video, we'll be covering the importance of maintaining an optimal blood pressure, how to measure your blood pressure, and the corresponding lifestyle changes.
It is very important to maintain the optimal blood pressure, which is defined as 120/80, because BP has significant effects on many health outcomes. Studies found that hypertension, or high blood pressure defined as blood pressure above 140/90, increases the risk of many other diseases. For example, hypertensive people are at greater risk of stroke, chronic kidney disease, heart failure, myocardial infarction, aneurysm, vision loss, dementia, and many more. So it is absolutely crucial to monitor and control your BP. Since blood pressure is associated with many health outcomes, lowering BP can prevent developing other diseases. Indeed, a study found that for every 10 mm mercury reduction in your blood pressure can significantly decrease the risk of developing the following diseases. Specifically, it can reduce the risk of coronary heart disease by 17%, stroke by 27%, heart failure by 20%, and even mortality by 13%. Now that we know how important it is to monitor and decrease your blood pressure, when should we measure our blood pressure? Many heart institutions recommend that you take your blood pressure twice every day at the same time, typically once in the morning and once in the evening. Take 2 to 3 readings each time with 1-minute intervals in between to increase the accuracy. Be still and relax while you're taking your blood pressure, and you should avoid tobacco, food, caffeine, and exercise at least half an hour before your measurement.
Measuring blood pressure at home can give a more complete picture of average blood pressure for patients who typically spend most of their time outside the doctor's office. In 30 to 40% of patients, blood pressure in the doctor's office is significantly higher than at home, while in 15 to 30% of patients, the blood pressure is significantly lower in the office than at home. These differences can be caused by stress related to the clinical setting or presence of doctors and other patients, leading to less accurate diagnoses and treatments for patients. Additionally, there are several advantages to home blood pressure monitoring. Compared to in-clinic blood pressure monitoring, home blood pressure monitoring is typically better tolerated by patients, is more widely available and convenient, preventing unnecessary trips to the doctor's office, and incurs a lower overall cost for patients. Furthermore, several studies actually show that home blood pressure measurements were better at predicting the risk of developing cardiovascular disease, as seen by the steeper correlation curve for home versus office blood pressure that you can see on the slide. In terms of blood pressure monitors, there are several blood pressure monitors on the market that are often seen as more convenient or comfortable for users. These include finger, wrist, and phone monitors that are less time-consuming and easier to use than traditional blood pressure monitors. These devices, however, are far less accurate, making them okay for people looking for a general idea of their blood pressure, but insufficient for patients looking to control and monitor hypertension and hypotension. So, what blood pressure monitor should I get? It is recommended that patients purchase a digital upper arm blood pressure monitor that is easy to use and provides more accurate readings. One of the most important things to consider is the cuff size, because the wrong cuff size can decrease blood pressure accuracy significantly even with the best of machines. You should aim to have the inflatable portion of the cuff cover about 80% of the circumference of your arm to ensure a proper fit. Make sure your display is clear and easy to use, and some even have storage to help you save or print your results for your records. Lastly is the cost. When deciding on a monitor, make sure you ask your physician for recommendations for approved monitors to ensure accurate reporting and explore potential options for insurance coverage. When recording blood pressure readings, proper posture is essential, both at home and in the office. Before you start monitoring, empty your bladder and sit relaxed and quietly for 5 minutes. Sit in a chair that provides back support with feet flat on the floor, and whatever you do, do not cross your legs. Place the cuff on your bare arm with the bottom of the cuff positioned above the bend of your arm. Tighten your cuff, ensuring that it fits snugly. Rest your arm on a supported surface that is around heart level. Do not talk or move excessively for the duration of your procedure. When taking blood pressure, it's also important to avoid tobacco, food, caffeine, and exercise 30 minutes prior to taking blood pressure. So make sure you try to take your measurements around the same time every day so you can start to build a routine. You should take 2 measurements in the morning at least 1 minute apart and following the procedure in the previous slide. Your morning measurements should be taken before you take any medications. You should take 2 more measurements at night just before going to bed. It is important to keep records of your blood pressure in a journal or document which you can share with your physician so they can monitor your progress and make adjustments to treatment if necessary. As always, talk to your doctor to develop a routine and treatment plan that best suits your needs.
When it comes to blood pressure, there are certain considerations we need to make. So first, some variation in blood pressure throughout the day is normal, especially as a response to small changes in daily life, like stress, exercise, or even how well you slept the night before. Secondly, if there's a big difference between the right and left arm, so more than 10 or more millimeters of mercury, this could be an early warning sign of cardiovascular disease. For example, you could have a clot in one arm. So it's important to measure blood pressure in both arms to see if there's a difference. Lastly, when you transition from sitting to standing, gravity causes blood to pool in your legs. For most people, this occurs just once in a while, but with age, some medications, and certain medical conditions, this can interfere with the body's normal mechanism for regulating blood pressure, and this is when measuring your blood pressure sitting to standing can inform your health state. For example, orthostatic hypotension can cause severe dizziness when standing up, and this can be easily identified when measuring it when you're lying down and when you're standing up. So earlier we mentioned measuring your blood pressure at different times of the day. So here we have an example of a blood pressure log. So feel free to pause the video, either copy this down or screenshot it or print it out. And this can also be found on the Hypertension Canada website.
Finally, I will be talking about the importance of diet for lowering blood pressure. So the DASH diet stands for Dietary Approaches to Stop Hypertension, also known as high blood pressure. The DASH diet emphasizes vegetables, fruits, and low-fat dairy foods, and moderate amounts of whole grains, fish, poultry, and nuts. Because the DASH diet is a healthy way of eating, it offers health benefits besides just lowering blood pressure. The DASH diet is also in line with dietary recommendations to prevent osteoporosis, cancer, heart disease, stroke, and diabetes. You can consume up to 2,300 milligrams of sodium a day, and by following the DASH diet, you may be able to reduce your blood pressure by a few points in just 2 weeks. Over time, the top number of your blood pressure, also known as your systolic blood pressure, could drop by 8 to 14 points, which can make a significant difference in your health risks. Here I have a visual explaining the different portion sizes of the DASH diet for healthy blood pressure. So for grains, it's recommended to take 6 to 8 servings a day, and grains can include bread, cereal, rice, and pasta. For vegetables, it's recommended to take 4 to 5 servings a day, and this can include tomatoes, carrots, broccoli, sweet potatoes, greens, and other vegetables that are full of fiber, vitamins, and such minerals such as potassium and magnesium. Fruits, it's recommended to take 4 to 5 servings a day. Many fruits need little preparation to become a healthy part of our meal or snack. Like vegetables, they're packed with fiber, potassium, and magnesium, and are typically low in fat, except for coconuts. Dairy, it's recommended to take 2 to 3 servings a day. Milk, yogurt, cheese, and other dairy products are major sources of calcium, vitamin D, and protein. But the key is to make sure that you choose dairy products that are low fat or fat-free, because otherwise they can just be a major source of fat, and most of it is saturated. For lean meat, poultry, and fish, it's recommended to take 6 1-ounce servings or fewer a day. Meat can be a rich source of protein, B, vitamins, iron, and zinc, so choose lean varieties and aim for no more than 6 1-ounce servings a day. Cutting back on your meat portion will allow room for more vegetables. For nuts and seeds, it's recommended to take 4 to 5 servings a day. This includes almonds, sunflower seeds, kidney beans, peas, lentils, and other foods in this family, which are good sources of magnesium, potassium, and protein. For sweets, it's recommended for 5 servings or fewer a week. You don't have to banish sweets entirely while following the DASH diet, just go easy on them. So for example, one serving can include 1 tablespoon of sugar, jelly, or jam, half cup of sorbet, or 1 cup of lemonade. When should you measure your blood pressure? Our blood pressure fluctuates during the day, so when you start tracking your blood pressure, you should check it at different times of the day, about 5 to 6 times. Once you establish a routine of checking your blood pressure and have gained a better understanding of the numbers, you can begin checking it once or twice a day at the same time each day. Getting into the habit of checking your blood pressure in the morning and again before bed is generally the best practice. For the AM reading, don't take it immediately when you wake up. However, you should measure it before breakfast or your morning coffee. And if you're taking high blood pressure medication, your blood pressure measurements should coincide with your doses. The best time to check it is before you take your medication. You should also make sure that you avoid certain things when measuring your blood pressure. Certain factors can increase your blood pressure, and it's important to understand how these spikers affect your blood pressure numbers. For example, with caffeine, there should be no caffeine intake for half an hour before measuring. For tobacco, try to stop this altogether, your heart will thank you. But if you can't, avoid for at least half an hour before you take your blood pressure. For exercise is great for you, but avoid doing exercise 30 minutes prior to taking your blood pressure. For food, make sure you always eat after you take your blood pressure recording. And for alcohol, avoid any consumption of alcohol for at least 30 minutes before checking your blood pressure. Most importantly, lose weight. The main message we're trying to convey here is to lose weight. Losing excess weight can help lower blood pressure. You can expect a 1-point drop in systolic blood pressure for every 2 pounds that you lose. And overall, if you stick with the DASH-style diet, a diet rich in the nutrients your body needs like potassium, magnesium, calcium, and fiber, and if you exercise aerobically or with resistance training, if you lose excess weight, and if you cut down your sodium by 1,000 milligrams a day, your blood pressure can drop from the dangerous hypertensive zone to a more healthier one, and you'll benefit with more energy too.
Before we conclude, I want to quickly go over medication lists and some important things to include or bring whenever you're having an appointment, either over the phone or in the clinic. So when you bring your medication list, first you want to make sure you always have an updated medication list with you, and we've listed an example here. And you want to make sure it has the medication name and the respective dose, when you had it last filled, so that we can give you a refill if necessary, and your pharmacy. As the holiday season is approaching, this is the perfect time to get your friends and family all blood pressure machines. We get a lot of patients who claim that their blood pressure is normal, always the same, or they've already taken it. Having a blood pressure machine at home and measuring it regularly is a first step to bettering your health. You can purchase a blood pressure machine at your pharmacy or even from our clinic, so make this a part of your wish list this year. So thank you for making it to the end of the video. I hope you learned something new. I hope that you'll be purchasing a blood pressure machine if you don't already have one, or you're purchasing one for a family member or a friend. With the holiday season approaching and during the COVID pandemic, we can still better our health together, and you can feel free to call our clinic for additional assistance.